Bansi sir and the whole Diabetes India team for giving me this opportunity. I prepared this lecture in half an hour. Just knows that I am having the lecture in the today morning or itself. So being the regular person who is doing the exercise, it is easier for me to justice this topic. The impact of sedentary behavior on the diabetes progression. So what is sedentary behavior? Prolonged sitting or low energy activities. So how it is something different from the person who is doing the regular activity. So even the physically active person can be a sedentary, having the sedentary behavior. Why? Because he is active in the morning, but if he is sitting prolonged 8 hours or 10 hours like us who are having the desk job, and many of the people are having the desk job, then we have the sedentary behavior. So why does it matter? It rises the prevalence due to the technology in the modern lifestyle. We are living in this era, and the reducing the insulin sensitivity and the higher the blood glucose level. It reduces the glucose uptake by the muscle. It increases the inflammatory markers like TNF alpha and the IL-6. Metabolic dysfunctions, it impairs the glucose metabolism due to the inactivity. So research has suggested that prolonged sitting is linked with the increased risk of type 2 diabetes, and the data trend shows that 112% higher risk with the highly sedentary individual, and it leads to impaired blood glucose control. So post-prandial glucose spikes sitting after the meals worsens the blood glucose level. So what we are talking about right now, sir has nicely answered all this question. Just want to add one thing that this is not the regular activity what we want to do in the morning, that brisk walk, and not we don't require that brisk walk or the cycling or the gymming activities after the post meal. If you want to reduce the post meal sugar level, then the 30 minutes after the meal, that has nicely mentioned that if you are diabetic and you want to reduce the post meal blood sugar spike, then after 30 minutes of your meal, 10 to 15 minutes of mild to moderate physical activity is enough. That may increase your heart rate to slighter extent, but you can easily able to communicate with other. You can easily talk with each other. That is the level of the physical activity what we require at the post meal level. So it is not that you go for the 10 kilometers of jogging post meal. So it is never recommended, but it should be in the pre-meal session. But the post-meal session, if you want to reduce this, then it should be like that. The increased HbA1c and so cardiovascular risk, what we are talking about in the previous lecture also, that sedentary activity increases the hyperglycemia, dyslipidemia, weight gain, insulin resistance, and increased risk of high blood pressure. So what is the problem? So first is the mental health problems. It increases the depression and the anxiety and the emotional eating. So if the patient is sedentary or the person is sedentary, then there is always a link of emotional eating. Even we, as a doctor, if we are sitting idle in the OPD, then we want to having some food. भूख तभी लगती है जब फ्री में बैठे हैं. जब काम कर रहे होते हैं तो कभी भूख नहीं लगती. So this is a common scenario, and what we eat at that time is mostly the unhealthy food. And the motivational challenge is fatigue because of the constant physical inactivity may also worsen this sedentary behavior. So recent studies have shown that the breaking up the sitting time improves the glucose level. So ideally, every person, even the normal person, should break that sitting time 30 to 60 minutes. Every 30 to 60 minutes, a few steps, maybe 2 to 5 minutes of walk, or maybe 2 to 5 minutes of stretching activities can help to break the sedentary behavior and can improve the metabolism. In the short term versus the long term effect, prolonged inactivity worsens the diabetes progression, and the small changes matter. Standing, even the stretching, significantly reduce the risk. So ADN and WHO guideline has recommended this. So sir has talked about this, and the practical strategies: walking after the meals if you want to reduce a post meal sugar level, using the stairs. Even for the doctors, if we are examining a patient by standing, if you lie down the patient on the examination table and you just walk, stand up from your table and chair and examine the patient and sit again, it will always break your sedentary behavior. It will helps you to get active. So many of our colleagues are in the OPD. They never say stand up from the OPD chair, maybe for 8 hours, 10 hours, they are constantly watching the patient. But just this simple change can help the patient, help their own health. So office-based solution can be standing desk. Like many doctors I had seen that they never sit for examining the patient. They run from one chamber to another chamber for examining the patient. Or walking meeting. If you have the call, then you can have the small walk during the call. Home-based strategies, household activities, or the TV time stretching. You may have some stretching activity during your watching the TV. It should not be ideally you should sit in the sofa and you should watch the TV. You can have that activities also. And the walking groups can be the solution. Wearable devices, smartwatches are there that track your movement, that how much physically inactive, how many times you, how much, how long you are physically inactive. Mobile apps are there which can track your glucose level and the activity reminders. And there are always the future trends about the AI smart health coaching for the diabetes management. So I'm not going in the cases, but simple examples like the 55-year-old male patient can reduce HbA1c by moving the every 30 minutes. Office worker with the gestational diabetes can control the sugar level with a standing desk or even moving 30 minutes after each meal for 10 to 15 minutes. They can reduce their postprandial spike. So studies are always needed. Longitudinal studies are needed for the impact of the long-term sedentary behavior. We are planning one activity, and many of the colleagues sitting over here, a senior doctor sitting over here for Solis push-up studies. We are planning all India level personalized intervention, tailored activities plan for the diabetic patients, and the potential role of AI is always there. Smart and adaptive movement plans can be there. So to summarize, sedentary behavior worsens the diabetes and the movement improves the health. And the small step reduce the complications, improves the outcome, and the encourage the movement, integrate intervention into the practice also. Thank you.